May I have your attention, please? May I have your attention, please? Will the real Slim
Welcome. This is Des and Lexi Show. Welcome to the Des and Lexi Show. And today, our topic is we're going to learn about PET scans, CAT scans, MRI, and autopsies. And get ready to go into the picture.
Wow. The purpose of various imaging technology is so that we can see different parts of the brain and the difference between structure and function. The anatomy of the brain. CAT scan stands for computerized axial technology, and it's used for the structure of the brain, while MRI, magnetic resonance imaging, is used for also structure of the brain, while fMRI is functional magnetic resonance imaging, and that's used to see how the brain is working. Autopsy is a post-mortem diagnostic technique that doctors use to find out the cause of death and
Okay, I'm fine. About being a director of the medical education, how is it with the EEGs, PETs, CAT scans, CT scans, and everything? How do you feel about that?
Well, I feel like it's affecting the gender equity in a negative way.
So you say. Wow, Richard. Mr. Rich. Call you Mr. Rich. I'm
Ask
sorry.
why.
Why do you think that, Mr. Rich?
Well, with various genders, two genders, various parts of the brain light up in different activity, and some regions of the brain are different in size, as in the body, in both male and females.
So you say, Mr. Rich. Wow. It was nice talking to you, Mr. Richie Rich. Thanks for talking to me.
She knows.
I was saying that
It started out with
way
X-rays.
back in the day, it started out with X-rays, which really only detects the bones.
Mm-hmm.
It doesn't really detect the other things
Soft
like
tissue,
soft
ligaments
tissue,
and stuff.
ligaments, all this other stuff that the MRIs can detect and the PET scans and different things like that.
Mm-hmm.
So by them being able to move forward with these type of technologies, they've been able to detect a lot of different diseases, a lot of different abnormalities that they weren't able to detect with just a regular X-ray.
Mm-hmm.
They were also able to implement things such as MRIs, that's something called MRAs, and also CT scans,
Mm-hmm.
where they can actually inject dye that go into the veins that actually they show the picture of how your arteries are, your veins are, and and where you're having problems, which they can detect aneurysms, things like that they're not able to detect with normal X-rays. So, by being able to implement these things, it's actually saved a lot of lives.
Yeah.
Because they're able to catch it before it gets to that point.
Mm-hmm.
Okay, now what else? They've helped with being able, I don't know necessarily if it's equity among genders, but I think it's given them, because of how the brain reacts, because for example, I can tell you, they can do an angiogram, and you're awake while they're doing it, and you're having different senses that are going off. They're telling you where you're gonna feel it in the left side of your brain, in the back, and they're telling you what you're gonna feel and what you're going to see and how you're going to respond. And what they're finding is that males and females respond differently to different stimuli than, it's not the same. And that's something they've been able to, determine. They've also been able to determine that parts of our brain function differently. We react to certain things differently. We process information differently based on the tests that they've been able to do with advanced technology. So as far as if it's helped to contribute to equity among genders, given for the reason for inequality, I don't know that it's given for the reasons for inequality. I think it's just helped to establish a better understanding of how the female brain works versus how the male brain works.
Yeah.
Okay?
That was awesome.
My shoes are tied.
Go. You don't have to start over.
The anatomy of the brain. You'd have an MRI. Other parts of the body. Is what's it called? What's the definition? Hold on.
Being a director of the, no, she's a surgical.
I said, tell me what's really going on. Drizzy back up in this thing, I'm ready. What's happening? Gone for certain.